Narcolepsy is a sleep disorder. Look at this: daytime sleeping and sleepiness and polysomnography findings. Look at this detail going on. Introduction. Narcolepsy is a chronic neurological disorder that affects the brain's ability to control sleep awake cycles. People with narcolepsy often find it difficult to stay awake for long period regardless of the circumstances. This disorder can lead to severe disruptions in daily activities and can significantly impact quality of life. Can you define narcolepsy? It is defined as a sleep disorder characterized by excessive daytime sleepiness (EDS) and sudden attacks of sleep. It is also often associated with cataplexy, a sudden loss of muscle tone triggered by strong emotions. Types. Narcolepsy classified into two main types. 1. Narcolepsy type 1. This type is associated with cataplexy and low levels of hypocretin, a neurotransmitter that regulates wakefulness. 2. Narcolepsy type 2. This type is not associated with cataplexy and typically has normal hypocretin levels. The cause of NT2 is less understood than NT1. Causes. Exact cause of narcolepsy is unknown, but it is believed to involve a combination of genetic and environmental factors. Some potential causes include one, autoimmune response. In type 1 narcolepsy, the immune system may mistakenly attack the cells in the brain that produce hypocretin. 2. Genetics. Certain genetic factors, particularly variations in the HLA DQB1 gene, have been linked to an increased risk of developing narcolepsy. 3. Brain injuries, trauma to areas of the brain that regulate sleep can lead to narcolepsy. 4. Infections. Some infections such as influenza or streptococcal infections have been associated with onset of narcolepsy. Risk factors. 1. Family history. Having a relative with narcolepsy increases the risk. 2. Age. Symptoms typically begin between age 10 and 30. 3. Infections and illness. Certain infections may trigger the onset of narcolepsy in genetically susceptible individuals. Complications. 1. Social and work related difficulties. Excessive sleepiness can interfere with daily activities, leading to problems at work or school. 2. Physical injuries. Sudden sleep attacks or cataplexy episodes can lead to accidents and injuries. 3. Mental health issues. Depression and anxiety are common in individuals with narcolepsy due to the chronic nature of the disorder. Pathophysiology. Narcolepsy is primarily related to the loss of hypocretin, also known as orexin, neurons in the hypothalamus. Hypocretin is crucial in maintaining wakefulness and regulating rapid eye movement sleep. The loss of these neurons leads to the characteristic symptoms of narcolepsy, including excessive daytime sleepiness, cataplexy, and disrupted nighttime sleep. Here is detailed step-by-step explanation. 1. Hypocretin neurons in the hypothalamus. 2. Loss of hypocretin neurons. 3. Reduction in hypocretin levels. 4. Disruption of sleep wake regulation, wakefulness. 5. Manifestation of narcolepsy symptoms. 6. Impact on overall health. Signs and symptoms. 1. Excessive daytime sleepiness, EDS. Persistent sleepiness regardless of adequate nighttime sleep. 2. Cataplexy. Sudden temporary loss of muscle control, often triggered by strong emotions like laughter or anger. 3. Sleep paralysis, temporary inability to move or speak while falling asleep or upon waking. 3. Hallucinations, vivid and sometimes frightening visual or auditory experiences at the onset of sleep or upon waking. 4. Disrupted nocturnal sleep, frequent awakening during the night. Diagnosis. 1. Polysomnography, PSG, an overnight sleep study that monitors brain waves, oxygen levels, heart rate, breathing, 2. Multiple sleep latency test MSLT measures how quickly a person falls asleep in the quiet environment during the day. It also measures how quickly REM sleep begins. 3. Hypocreatine level measurement. Low level of hypocreatine in the cerebrospinal fluid can confirm type 1 narcolepsy. Nursing diagnosis. 1. Fatigue related to excessive daytime sleepiness. 2. Risk for injury related to sudden sleep attacks and cataplexy. 3. Impaired social interaction related to narcolepsy symptoms. 4. Anxiety related to fear of sudden catalepsy episodes. 5. Disturbed sleep pattern related to fragmented nighttime sleep. Management lifestyle modifications. 1. Schedule naps. Taking short, planned naps during the day can help manage sleepiness. 2. Good sleep hygiene. Maintaining a consistent sleep schedule, creating a restful environment, and avoiding caffeine or alcohol before bedtime. Safety precautions. 1. Avoiding driving. Patients should be cautioned when driving and may need to avoid it altogether during periods of excessive sleepiness. 2. Occupational adjustments. Work accommodations may be necessary to manage symptoms and ensure safety. Treatment. Medication. 1. Stimulants such as modafinil or amphetamines to reduce daytime sleepiness. 2. Antidepressants. SSRIs or SNRIs can help manage catalepsy. 3. Sodium oxybate helps improve nighttime sleep and reduce catalepsy. Psychosocial medicine. 1. Counseling helps patients cope with the emotional impact of narcolepsy. 2. Support groups. Connecting with others who have narcolepsy can provide social support and shared experiences. 3. Education. Educating patients and their families about the disorder, treatment, options, and lifestyle modifications is crucial. Prevention. There is currently no known way to prevent narcolepsy. However, early diagnosis and treatment can help manage symptoms and reduce the impact of the disorder on daily life. In conclusion, narcolepsy is a complex and chronic disorder that requires a comprehensive approach to diagnosis and management with appropriate medical treatment. Lifestyle modifications and psychosocial support individuals with narcolepsy can lead fulfilling life despite the challenges posed by the condition. Early intervention and continuous management are key to improving quality of life and minimizing complications. Thank you. Have a wonderful day.